Okay.
Okay, this is where the messages come, whether it's your fax document or a scanned document or a message from a family or another physician. Like for example, each message, whether it's a document, fax, or a message from the families of the patient, gets attached to the patient chart. And it's also date and time stamp. And every message module has access to it's actually a kind of a message workbench where you can look at the demographics if you need to call the patient, or you can look at your last notes to see what you changed. So if the question was about it, or you had a chest x-ray ordered and you forgot what it is for, you can basically look at it. And you can look at the document management if the chest x-ray has to be compared with the old one. So you click on the document management and you can pretty much go navigate your way out. And also you can update, like for example, a mammogram results come back and then you click on chart update. It takes you to the last notes section, and you can go and do your interim chart update at that time. This patient was seen less than 7 days, so you can actually go ahead and update. If it's more than 7 days, you'll see a sign of interim edit, and then you will be able to edit from there. So when the patient comes for follow-up, it's already updated, so it's easier for you to navigate. This is something that I just love as an internist. For example, if the patient is calling in with the UTI symptoms or excessive, any of the symptoms that changed, then I can go look at the current meds to see what are the list of medications, or I can look at the allergies. Or I can just connect to e-prescriptions and send prescriptions right back to the pharmacy. Especially after hours, and I'm alone in the office doing the message, so the patient don't have to wait for 2 days. Also, this is a virtual visit where we order any labs or x-rays that is attached to the patient chart. Or I can say I called the family, so I can just say call the family to say continue the same medication, see me in 2 days, and I can also view at my previous cost to that patient from the screen. It also gives me an idea, like for example, I see a chest x-ray that is kind of little abnormal but nothing really outstanding. Then I look at the next appointment, and then what I do is, just to remind myself, I click on future delivery and I add 6/1 to deliver. So if the patient didn't show up, at least I know that reminder come to my mailbox and reminds me, okay, that needs to be addressed. So like for example, let's say it looks like they've uploaded a chest x-ray, and I go to manual signature. It takes me to the screen. The first Java upload is a little slow, and then now this is okay, and I know the patient is at the hospital, so I can just acknowledge I saw this, and then I'm going to close it. And I am closing this, and I'm going to go to my next message, and I see this is the CT brain. Again, this patient is probably at the hospital again, so I'm going to just look at it, and nothing I didn't want to update at this time. I'm going to just acknowledge. I'm going to go to my second message. Let me take some examples of messages like this patient. Okay. I'm going to send, this is a cervical spinal stenosis. I know this patient well, so I didn't have to check anything. I'm done. And I'm going to be going to my next message. This patient wants a prescription for a pain medication, and I'm going to send it to my and I'm sending it to my MA to take care of that. And I'm going to be going to this patient, and this again is okay, so I just say I know this patient well, so you're going to be going here, and this is just a message. I'm okay with that. So just like normally we do, it just makes it more efficient because you have access to everything. Like for example, this is a document that I had from an assisted living facility wanting to know what to do. And this is basically, they requested a signature. I've signed it, and I'm gonna send it back to my MA, so she'll be able to fax it back to them. And also, for example, this patient, the facility said that the patient is very confused what to do, and it was so useful that I was able to look at her medications from here and look at her last notes, and I realized that she has a recurrent urinary tract infection, so I ordered, changed her medications around, and now it's ready to be sent back to my staff to take care of it from her end. So everything is streamlined. That's where your efficiency comes, and I think this is one of the areas that physician's office struggle, and I feel that the system has done the best to help to be more efficient, more precise, and save time and less stress. Basically, everything is so organized.